Hi, this is Dr. Smith. This video is on coronavirus and some of what we found. I'm an integrative medicine doctor, and so we deal with chronically ill patients all the time in difficult situations. Now, we know a little bit about the pathology of this. It binds to the ACE receptor. It causes pro-inflammatory angiotensin 2, which increases blood pressure to be increased. Angiotensin 1-7, which dilates and is anti-inflammatory to be blocked. So what we have is an inflammatory situation. We're inducing inflammatory cytokines. They cause van Willebrand's factors to increase, causing capillary clotting, damage to membranes and capillaries, and they produce superoxide and other reactive oxygen species. Now, we deal with this in integrative medicine all the time. We control them with an antioxidant system. We have one built in, glutathione being the primary compound, followed by lipoic acid, which is more membrane and fatty membrane tissue specific, CoQ10, N-acetylcysteine, vitamin C, vitamin E. So we're good, right? Well, we are good when we first get this because the symptoms don't occur for about 5 days or so on average. That's because the viral load has not increased to the point where we have enough reactive oxygen species to overwhelm this system. Once this system is intact, you're not going to have symptoms from this virus. And if you have enough of this, you'll never have symptoms. And that's why the young people will have a good antioxidant system. They don't get sick. They just control the reactive oxygen species, and the viral load goes up until it just levels off and then finally goes down after about 19 days. Now, if you're symptomatic, this is not covering this as this increases. And if you're really sick, you've got diabetes, other cofactors, you're old, and heart disease, and other things that you have low glutathione, low lipoic acid, and this is almost universal in chronically ill patients. I know this because I've measured it. I use a test called the NutriVal, and I've measured hundreds of these people. I've yet to see a normal lipoic acid. Most of them are in the severe nutrition. Glutathione is almost always low as well. I think I've seen 1 or 2 normals. So that makes you a sitting duck because for the system, that's why these people get so sick. Now we have some drugs that reduce viral remdesivir, hydroxychloroquine, or Vectamine, and some others, but they just slow this virus down. Oxidative therapy, that's UV blood irradiation, major autohemotherapy, where we take blood out, mix it with ozone, put it back into the patient, and hydrogen peroxide. Now that was used successfully in the flu pandemic of 1918. I don't see any case reports of this. We have a case report out of Spain, and it was successful in reducing the hospital stay from 28 days to 7 days. So, but not nearly as effective as this therapy, which is to reduce the oxidative stress by increasing these antioxidants. So if you don't have enough, we can give these agents IV. So what would you expect to happen? Well, glutathione binds with reactive oxygen species instantly, within less than a second. The lipoic acid hits the membranes where most of the damage is occurring. And vitamin C has also been shown by Dr. Merrick to be helpful. And NAC is in a big trial. I don't think it's going to be as effective as these two. These are the two we use most in common, and we sometimes add this one. We've used it for people with back pain. These agents are quite safe. There are literally thousands of peer-reviewed studies done on these compounds. But they're not drugs. NAC is, but most of these are just naturally occurring agents. Also, inhalers have been used in Taiwan, Japan, more used early. They have a robust contact tracing. They have a robust testing thing, so they get to people early, and then nebulize this in there, and they get the reactive oxygen species at the point in the lungs where they're causing symptoms, and that has been effective as well. Let's take Taiwan, for example. In New York, I can't remember how many people have died, but in Taiwan, with a population of 24 million, they haven't had enough deaths to fill a minivan. 7 total. So in Japan and Singapore are having similar success. Now, this therapy, I had a lady, she had been sick since March. She got it in her gut. She was vomiting everything she ate and had tons of mucus. Then she got it in her lungs, had to sleep upright, and was bringing up tons of sputum. She'd go into respiratory distress. Her cat would wake her up, and she made it. And we treated her with the UVBI, and that helped a little bit. And we gave her some drugs to thin the mucus. We didn't really realize what we were dealing with at that point. Then we gave her this combination of glutathione and lipoic acid. After 4 months of being ill and being seriously ill at the time we gave her, overnight she was better and ready to go back to work. It was absolutely amazing. Now, that's just one case, but Dr. Horowitz in New York, he's a Lyme doctor, he treated 2 of these patients with positive lung disease, x-rays, positive tests, everything, showing they had severe COVID-19 disease. He must be a little bit better doctor than I am, because these patients got better in an hour. And so he was pretty excited about this. He's been a part of the government health services before, so he called the CDC and everybody he could to get a trial done, because we really don't know if something works based on 1 or 2 things. We need a controlled clinical trial. You would think there would be a huge amount of interest. No interest whatsoever. CDC, not interested. So we have a treatment that appears to be working, that could stop this virus in its track, put people back to work, and save thousands upon thousands of lives, and no one's interested in doing a trial. So I urge you to go and look what he's done. It's Dr. Horowitz, Clinical Trials on COVID, and take a look at that, and then get a hold of whoever you can to see if we can get this clinical trial done, because we're losing lives because people are not understanding how to treat this. And from what we can see, it's easily treated, but we need trials. Thank you. I'm Dr. Stephen Smith.